Hello everyone. Have you ever wondered a tumor and its knowledge of biochemistry? So how does the knowledge of biochemistry helps you to understand the pathological knowledge and helps you to correlate the prognosis and the treatment of a cancer? So a tumor cells, as you know, is richly supplied with the blood vessels and it grows on and on. But if you have a chemotherapeutic reagent specially designed for this cancer, you may be able to treat this. In this video, I will tell you a novel mechanism or novel way of diagnosing and treating a cancer by a new thing called as oncometabolism. Let's understand what exactly does this oncometabolism mean. Well, you might have heard about isocitrate dehydrogenase. That means you might have heard about this TCA cycle. A TCA cycle has this, all these enzymes coming up. But what you might also remember that there is an enzyme called as isocitrate, and this isocitrate is acted upon by isocitrate dehydrogenase to make it alpha ketoglutarate, on which again acts alpha ketoglutarate dehydrogenase, and this obviously forms NADH and converts to succinyl-CoA. Now this is plain biochemistry and a Krebs cycle or TCA cycle. How do we put this knowledge into hand when we're understanding something called as oncometabolism? So see what happens sometimes, guys, that it's a surprising genetic alterations which is discovered by a novel mechanisms. So what happens sometimes, this isocitrate, what I'm talking about here is something called as oncometabolism. Okay, a new update of oncometabolism. So isocitrate dehydrogenase, it sometimes is acted upon by IDH as the normal IDH. I can write this a wild type of IDH. A wild means unmutated. Okay, it's normal, and this forms alpha ketoglutarate. This we all know. Okay, we all know this, and this again then changes to succinyl coenzyme. Everything is normal here. Well, what happens sometimes is this isocitrate dehydrogenase, it has a mutation. So this alpha ketoglutarate, this upon action by the IDH1 or the IDH2, which we can say it's a mutant form of IDH, this converts the alpha ketoglutarate to something called as 2-hydroxy. Okay, it is called as 2-hydroxy glutarate. Well, this actually, which is referred to as 2-HG, this becomes an oncometabolite. I'll tell you why and how. See what happens, this 2-HG, it basically starts inhibiting a variety of substrates. It starts inhibiting a variety of substrates because this has now a new function. Remember one thing, that the IDH mutation, it now acquires a new function because of which a new product is being formed called as 2-hydroxyglutarate. So what happens, guys, this 2-hydroxyglutarate, remember this is very, very important. This 2-hydroxyglutarate, this is called as oncometabolite. This is being called as oncometabolite. If you ask me, sir, why it is being called as oncometabolite, the answer is this leads to inhibition of a product called as TET2. Remember, guys, that TET2 normally controls. If I tell you what does a TET2 do, remember a TET2, this gene, it normally controls the epigenetic modifications. Epigenetic modifications. In simple words, it causes DNA hypermethylation. It causes hypermethylation of the DNA. It causes hypermethylation of the DNA. That means if the 2-hydroxyglutarate is inhibiting the TET2, so this inhibition of TET2, this causes abnormal DNA methylation. This leads to abnormal DNA methylation. And remember, guys, with the abnormal DNA methylation, it causes abnormal epigenetic modification. I should not remind you, epigenetics is something in which a DNA sequence does not change, but still the DNA expression changes. It's called epigenetics. So now what happens, this abnormal DNA methylation, it leads to abnormal expression of the cancer genes. It leads to abnormal expression of cancer genes. A few of them that you must remember is like the RAS and the receptor tyrosine kinase. Receptor tyrosine kinase. Remember one thing. So, is this responsible? And what happens? This abnormal expression of cancer gene, this leads to obviously the tumors. It leads to the tumors. Now, the point to understand here is you may not be able to inhibit a wild type of IDH because drugs are not available against it. But yes, you may be able to inhibit the mutated form of ADH. Yes, you heard it correct. There are some drugs being developed which can basically inhibit the mutant IDH inhibitor. That means there are some drugs developed against this one. There are some mutant IDH1 and IDH2 inhibitors. And this is what is the recent discovery. This recent discovery is being called as a breakthrough mechanism of treating certain cancer which have this IDH mutations. What are those drugs? Remember, recently approved drugs which come in this category, there is mutant IDH1 or IDH2 inhibitors which actually are FDA approved. FDA approved. These are some which are called as Sidinib. Okay, Sidinib. Now with Sidinib, there are two types of Sidinib which have been discovered. One is ENA, ENA, ENA Sidinib, and one is EVO Sidinib. EVO Sidinib. Now these two are being used to treat those cancer which have this typical mutation of IDH. Remember, only mutated IDH. Therefore, we say a mutated IDH has a better prognosis compared to a normal or an unmutated or a wild type of IDH. Which are those cancers? So we will see they are helpful in some tumors which have the mutant IDH mutation. Mutant IDH mutation of I means mutated. These are gliomas, which I'll tell you a bit in separate also. AML, again this is very important. AML, it can be peripheral T cell lymphoma, peripheral T lymphomas, it can be chondrosarcomas, it can be cholangiocarcinomas, and also prostate cancers. So these drugs are being used to treat these all tumors nowadays. All of them are being used to treat nowadays. Remember, among them I should not miss gliomas because this is a definite breakthrough coming up. Remember, among gliomas, let's talk about glioblastomas. So glioblastomas, which I also discuss in my regular classes, if you remember, the glioblastoma, if you will remember, it simply is a World Health Organization grade 4 brain tumor. Remember, it's a World Health Organization grade 4 glioma. Remember, so the glioblastoma, it is IDH mutated form or can be IDH wild form. A few things that you must know here is that the IDH, which is a mutated form, is called as secondary and is seen in younger age. This type of tumor are those in which the low grade gliomas, they have progressed to the grade 4. Now if you compare this information to the IDH wild type, those are called as primary. They're seen in old age, and remember, they are new tumors. Now what else should you know? Obviously, one information is IDH mutation here, and this is IDH wild or unmutated type. Now remember guys, one more thing, that there are some other mutations that is seen. Other mutations which can be seen in this gliomas, which may be a question this year. It is P53 and a ATRX mutation. P53 mutation and the ATRX mutation. But the same thing in the primary or the wild type of glioblastoma is a TERT mutation, TERT, the TERT mutation, and a gain of chromosome 7 or a loss of chromosome 10 chromosome. This may be seen. Now if I tell you, what should you actually be concerned about? You should be concerned about the treatment. So among these two, which can be treated by the drugs, that is inacidinib and evocidinib? Obviously, it is mutated form, that is the secondary glioblastomas, not the primary ones. And therefore, remember, the overall survival of this after the diagnosis is 2 to 4 years for IDH mutant 5 and 6 months to 2 years in a wild type of glioblastomas. And therefore we can say it has a better prognosis being better in this one, and this is poorer in the unmutated or the wild form of glioblastoma. So as you understand, this oncometabolite is a recent breakthrough, and I can tell you every brain tumors, especially glioblastomas or AML, should be actually seen for a IDH mutation either by the immunohistochemistry or a genetic analysis. And if they are mutant, those drugs are definitely started to give a good prognosis to the patients. Isn't it new? And that is how you correlate biochemistry, pathology and everything. That is the coming up future. I hope you liked the video. If you really liked it, do like, subscribe and comment on this video. Thank you. Good wishes and stay blessed.